Hi everyone, I'm Dr. Byrne. Welcome to Revive TV. If you've been suffering from lower back pain or know someone else who's been suffering from lower back pain, then today's episode is a must watch for you. We're going to dive into the 5 leading causes of your lower back pain. And at the end of the video, if you watch all the way through, we're going to offer you a special gift. A gift that we know will help you to start and implement changes that will help to resolve your lower back conditions. So enjoy today's episode of the 5 leading causes of lower back pain. Before we dive into this week's episode and the topic, I just want to share with you a few things that are going to be happening over March. As we've previously said, we're going to change topics each month, and this month's theme is going to be around movement, all things movement. Our sub-theme this month is going to be around lower back pain. So we would say 75% of the people that come into our practice are suffering lower back pain, and if you're a member of our practice, that may have drawn you in here, or if you're watching this, you may be suffering this yourself. So we're going to have this sub-theme, we're going to dive deep into this topic. So if you've got those things, you're going to want to watch the next 4 weeks. At the end of the episode, we've got some giveaways, some downloads that you can take away to help you, and also some events that are coming up that we're going to mention right at the end there. So stay watching and we'll get to that then. So this week's topic, this week's episode is the 5 leading causes of your lower back pain. Before I get into that though, I want to talk about the conditions, the difference between a condition and the cause. So a condition is the end result or the collateral damage as a result of the cause. So what are the kind of the leading conditions that most people come into our practice with? So really common, muscle or ligament sprains or strains. We might have bulging or ruptured discs. We have arthritis or different forms of arthritis. A common one is a spinal stenosis. A stenosis is where the little hole that the nerves pass through, or the foramen they call it, is enclosed. There's extra bony growth which starts to encroach on the nerves, and we also have spinal distortions, postural distortions. A common one, scoliosis. Most of us have heard of that, where we have some curves of the spine. Some people are born with it, some people develop it as they go forward in life. So these are the end results or the conditions that people come in with. But these aren't necessarily the causes. These are what happened as a result of different causes. So we're going to dive into those 5 leading causes, and it might be ones that are associated to you directly, and there can also be a combination. It might just be just one, it might be a combination of 2 or 3 or even more that is causing your lower back pain or the people that you know. So the 5 leading causes, we're going to start with the first one, and it's direct trauma. So this might be from a sporting accident where someone hits you in the back, or you have a fall and you fall directly onto your back. And this one is usually an acute condition, meaning that there's no real previous history of lower back pain. It's a result of the actual incident that's occurred. Okay. Commonly, these are the ones that can clear up the quickest if they're not too severe. Because there is no underlying history or condition that's there previously. The second one, and this is a common one, people come and go, oh, I was just lifting something and I hurt my back. So it could be improper lifting, but more commonly it's probably improper lifting over a period of time, repetitive strain. So it can either be repetitive strain, doing the same thing poorly, often, or it could be that we lifted something too heavy. You will know whether it's just something that was beyond your means to begin with, or whether it was something that was just beyond your means on that day, given that there was a history or a possible history of lower back distress or a condition previously. So more often than not, the people we see in our practice have usually had this repetition. So how do you know whether the condition may have been there previously or there may have been some underlying issues beforehand? Well, just think about the object that you lifted when you hurt your back. Was it something that you have lifted previously before, oftentimes, or at least done it before? If you have lifted that object or a similar weight object before and you didn't experience lower back pain, it probably means that there was something underlying, and this last time that you lifted was really just the straw that broke the camel's back. Okay, so there's the difference in terms of working out whether it was the object or whether it was something that's underlying. More commonly than not, there's probably something underlying going on before you even realize, and we'll get to that in the next couple of causes. Might give you a bit of an insight as to why that could possibly be. The third one, which probably relates to, based on data, 2/3 of our population. 2/3 of our population are considered overweight or obese. So now having excess weight, especially at the front, through the tummy, and that's more commonly with men. We tend to carry our weight, if we're a bit overweight, we tend to carry it on the front, women more to the sides. So you think about this, and pregnant women will understand this. When you have weight to the front, your center of gravity is shifted forward. So your belly comes forward. You're probably not going to see this on the video that well, but your center of gravity is shifted forward, which means my back starts to arch. Now, if you're in this position for a long period of time, it's requiring muscles to work differently, okay, for longer periods of time, and can start to fatigue those muscles. And as I said before, pregnant women will only know this too well. I'm only taking it on what I've been told and what I'm shared with. I clearly can't have experienced it myself. So, but if that center of gravity shifts, it's going to start to put excess strain on muscles that don't want to be in that position or don't want to work that way. And over a period of time, this excess weight can start to contribute to other conditions, the end result, the lower back pain. So often, and with that excess weight, can sometimes it slows down the healing, often because that is a constant stressor. So while we're getting people to make changes, one of the things we want to consider is, an ability to try and lose some weight is going to help the healing and obviously hopefully prevent or at least decrease the chances of your lower back pain coming back. The last two are really close to my heart because what we concentrate a lot on in our practice. And one is that's around a lack of movement. So before I get into that, I also want to talk about what muscles actually do. So they basically have two main functions. A muscle is either a doing muscle. For example, a doing muscle is, say, your chest muscle or your pecs. They will if I want to push out, the muscles actually help me do that. And then there's muscles that are stabilizers or postural muscles. So you'll have stabilizers around your shoulder that allow me to keep this motion effective and efficient. We're going to focus on the ones that stabilizers of the spine, especially because we're talking about lower back pain. So there are little muscles either side of the spine that allow us to stabilize us when we do motion, okay? So what happens is when we have when we have a lack of movement, when we don't move as we're intended to, is that these little muscles start to lose their strength endurance, okay? It's not that you have to do exercises to make them strong and they don't lift weights, but they have an endurance to allow you to do the movements that you are required. So what kind of things shut these little muscles off or help them to, or contribute to them losing their endurance? Well, living a sedentary lifestyle, and unfortunately, probably 80% of you, or at least 70% of you watching this video are leading sedentary lifestyles, meaning your job just requires you to sit down. There's not much you can do about it, but your job requires you to sit down. And so when we sit down, these muscles aren't needed to hold the spine up. So they start to shut off, okay? They start to lose their endurance. So what happens then when we try to move and we try to ask them to do movement, exercise or whatever, over a period of time, what happens is the big muscles that are doing muscles will start to try and stabilize you as well as move you. Now you think about that. That's a lot of work to do. They're trying to do an action, but they're also trying to stabilize you. They become really fatiguing, and that's why when you come and see us, you go, I feel really tight in these muscles on the side or in my hips and my buttock muscles. That's why when you come in and you say those things, these muscles have been working extra hard, not only doing action, but also stabilizing. So functional movement is really vital. One, before you, to prevent lower back pain, but also through the recovery process to make sure you're moving without pain, but make sure you're moving again to get those little muscles working again. Pilates or core work is a great example of things that can help do those things. But if you're already doing functional movement, might be like, if you're from an exercise perspective, doing squats or deadlifts, doing pull-ups where you're using your whole body, you're going to largely switch these muscles on without actually having to focus on it. Okay, so functional movement or a lack of movement is a major cause of lower back pain. The last one, the fifth one, comes around posture and spinal distortions. Now before, when I talked about conditions, I talked about posture and spinal distortions being a condition. Well, what I'm saying to you with this one is actually a condition and a cause. Okay, so it can be both. So when we talk about posture, I'm talking about overall posture. For example, with postural changes, we might see things like this, and I'm just going to turn to the side where we see people with their heads forward, this forward head carriage. It's very common, especially in our society today where we are sitting a lot, so we're looking down at a computer or we're looking down at an eye device of some sort. It's creating this posture where we've got this head tilt coming forward. Now what we know is that as soon as your head comes forward and gets that position, that the natural curve of your lower back is lost. It flattens it out. Okay, so that changes the muscle composition, the way the muscles are working as well. So commonly we'll see these postural distortions, whether it's in the lower back or maybe your pelvis is tilted back or tilted too far forward, or one hip's higher than the other. We'll see these distortions in your posture that may be contributing to your lower back. So when we assess posture, we assess the whole posture, not just the lower back, if the condition you've come for is lower back pain. So posture plays a huge part. The other one is the spinal distortions. So actually at each segment, so joint to joint motion. So there should be a normal motion in each joint, and as chiropractors, we'll commonly call spinal distortion, where it's not moving as intended, a subluxation. And one of the things we know about a subluxation, or these spinal distortions, where it's not moving as it's intended to, is that the nerves at that level that talk to the little stabilizers right at that level, they shut off. So they inhibit the little postural muscles from activating as they are intended to. So having proper joint-to-joint spine motion not only will help you make sure those little muscles aren't inhibited, that they're getting the message that they need. So that's a very important aspect of looking at the conditions, but the causes is part of your cause a spinal distortion, or more globally, could it be a postural, an overall postural distortion. So they are the 5 leading causes of lower back pain that we see in our practice. So they are, again, direct trauma, which is usually acute and probably the quickest to heal because there's usually not a previous condition. Improper lifting, whether it's too heavy or too often of the repetitive motion. Excess weight. The fourth one is improper lack of movement, lack of functional movement. And the last one is posture or spinal distortions. So how do you know? Well, you may need to get assessed to work out if you've got a combination of those things. One of the things you can do though right now is just download our Healthy Lower Back Checklist. So there's a little checklist there. You can check off and see what you're doing to make sure that you are doing as many of the right things to, 1, prevent lower back pain, or 2, if you've got lower back pain, to move towards getting away from that. So download that here. Just click the link below. It'll take you to that download. The other thing you need to understand is that your body requires movement. We've talked about functional movement. There are requirements for your body in general to be optimally healthy, not just for getting over lower back pain. So I would encourage you to look out for our next event. It's on Tuesday, the 27th of March, 7 o'clock in the practice. At the moment, you can register by calling the practice. I'll provide the email address in the video here, so you can actually email us if you'd like to. At some point in time, we'll have it up as an event on Eventbrite, but we don't have that right now. So get the download, get the checklist, register for the event, start to take control of your lower back pain. Please share this with anyone you know who is suffering lower back pain, or you think may need to hear this information. It's through you guys that we can reach more people. I want to thank you again for watching this week's episode of Revive TV. We're going to dive deeper this month into lower back pain, and so make sure you keep watching, and we'll see you next week. Thanks very much.